Dear friends, hi. Welcome back. Welcome back to Alpha Physiopelvic Care, all things pelvic health. If you're seeing me for the first time, my name is Anastasia Varova. I'm pelvic floor physiotherapist specialist practicing in sunny Cyprus and online. And here in my channel, I'm sharing all my tips, tricks, exercises, advice, experience, sometimes thoughts about my work and my profession. This is the second kind of part of the video that I did previously for upper diastasis recti, and today we will have a look for the exercises for lower diastasis recti. In case you don't know what diastasis recti is, diastasis is abdominal line separation, a gap around the belly line here. Especially this is common for women after birth, not exclusively, but very common for women after birth. Sometimes you can have separation on the top, what we were talking about previously, sometimes all the way through, and sometimes more of a separation at the bottom. So at the top, everything is nice and tight, but at the bottom, the gap is quite large or larger than the rest of the place. So today, I will show you 4 exercises that you can start doing in order to help yourself to improve your lower diastasis, to connect with your lower abs. And we will use our well-known friend, loop elastic. Loop elastic because it's such an easy, such accessible piece of equipment. You can take it with you everywhere. It doesn't take any space, but it's very effective because it provides us with resistance. And we do need resistance when we treat diastasis recti. We need control resistance going through our connective tissues in order for them to heal. Before we begin, don't forget to press like on this video, follow my channel if you haven't done so yet, and also let me know in the comments what was your experience. What was your experience with diastasis recti rehabilitation? Do you have one? Have you tried doing exercises? What helped you? Also, I would like to announce that I have a very fresh and new out of the oven post-pregnancy recovery program. It's 36 exercises, 25 to 35 minutes each, that will last you for 6 weeks if you do them every day, but you can do them anywhere between every day and 3 times a week. Every set is different, every set is unique, and it is progressive. So you start very gently, very easy, and then you slowly progress, and this is what it's needed when we talk about pelvic floor and diastasis recti recovery. Suitable for everyone who would like to improve leaks, heal their diastasis recti. Maybe you have a prolapse and you would like to improve your symptoms. So check out the link below. I will leave it in the description. You can try 2 free lessons, and I hope you enjoy. Let's begin with our exercises. So first exercise, we're going to connect with our lower abs. We're placing the elastic just above our knees here. We're laying down onto our back, and it's very important here to have a neutral position. Neutral is feet parallel, weight is going through your sacrum here, a tiny gap under your waist, so we don't want to be too arched, nice and small gap. Ribs are nice and connected down with imaginary springs. I talked about them a lot in upper diastasis exercises. Nice and tall head, open shoulders. And here we try to avoid a lot of spinal movement for time being. Okay, it has its time and place, but with these specific exercises, we really want to find our deep abs, connect with the deep abs. All right, and therefore we try to avoid spinal movement. So we start with a nice breath in into our back and sides for 3-4 seconds to prepare. As you breathe out, you do your pelvic floor engagement, so your gentle kegel, and at the same time you think about like you zipping up the zip, zip lock. And you pull your right knee towards your body without moving your spine, remember, yes? Breathing in and engage, breathing out. Stabilize yourself, zipping up the core, engaging your pelvic floor, pulling the knee. It can go slightly beyond 90 degrees, but as soon as you feel resistance, breathing in, engage, breathe out. By the way, if you have zero idea what I'm talking about, pelvic floor engagement and how to find it, I have a video of finding your pelvic floor with a towel. Check it out, where I explain in details how to find your pelvic floor. And I also have many more videos on pelvic floor tips where I'm explaining how to find the correct squeeze. So we basically imagine that we squeeze and try to stop the pee, and we keep squeezing, squeezing, squeezing up. Keeping our ribs connected, feeling tension here as we lift, as we breathe in. We relax without letting ourselves to go into arch. Breathe out, breathe in. And out, engage. In, engage. Breathe in, engage. Nice. And we repeat it about 12 reps altogether, 2 sets. All right, we did this exercise. Let's move on to the next. We stay on our back, but I'm not a huge fan on being only in one position, so for the next one we change. But for now, we're trying to engage a little bit more our side abdominals, so our obliques, by asymmetric movement. So exactly the same, we breathe in to prepare into our sides. As you engage your pelvic floor and zip up the core, keep your ribs connected, you open up your right leg without letting the rest of your body shift. So the more you open without letting the rest of your body shift, the more connection here is. If you feel you can control the movement only up to here, tiny opening, that is fine, okay? Your weight stays in the middle of your sacral bone. Breathe out. My pelvic bones are steady, they're not rotating away. And my other leg does not overcompensate with the movement to the side. And breathe out. Breathe in. Engage. In. You should feel kind of tension next to your pelvic bones. If you feel that, then your deep abdominal muscles are kicking in, and it's a good sign. Let's do a couple of more reps, engaging, engaging, engaging the pelvic floor. If you at some time lose it, don't worry, just re-engage it and continue. Nice. So again, I'm doing about 12, 16 reps all together, times 2 for 2 sets. And let's move on to a different position. Here we will be on a 4-point kneeling, but the elastic stays the same. Again, our point here is to control our lower abs by adding stress, let's say, or challenge with our lower limb, with our legs. All right, so we go hands and knees. Very important here to keep your back nice and straight. We don't want to go into a lot of arch, neither we want to over push it. So imagine you have a table, nice and straight table, and you can place 4 glasses on it, right? Sometimes I give a challenge to my clients by placing a ball here on their pelvis, or something that might fall off if you do this or this, so they can feel the neutral. So you can try it yourself. Arms and legs parallel. And here we're going to breathe in, breathe out, and I'm going to lift my leg up, up. I feel the stretch, 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 feeling the engagement here, and down. Now, just a little practical tip. Because I have the elastic here on the skin, it will not slide. On the clothes, it might slide. In order to avoid the sliding, what you can do is you go with one knee onto the elastic in order to fix it, okay? So this is just a little pro tip, as they say. So again, we're breathing in, engaging our pelvic floor, our tummy. So draw your belly button gently to the spine. Keep also your lower ribs connected, and lift, lift, lift. Steady, steady. Don't allow your back arch. The point here is to keep this area neutral, because you keep it neutral with your deep abs, okay? If you relax your abs, you immediately will go into arching. Let's repeat. Engage. You can add a bit of bottom squeeze, of course, but this is not yet the point of the exercise. The point is to focus, focus, Focus on the deep engagement, feeling that your abs are supporting you. And for some of you, the lift will be only up to here. And then you feel like you're losing it, which is fine. Long breath out. Breathing in as we drop. A long breath out. Breathing in as we drop. A long breath out. Nice. We repeat about 10 times, 2 sets, and of course, do not forget to do it on the other side. Whilst we will be moving on onto our fourth exercise on the side. For the fourth exercise, I'm moving my elastic around my ankles and laying down on my side here. Very important is the body setting. So our head, our hips, our knees are in one line. Quite often I see people laying down with their legs in front like this and they feel like they're in neutral. So you can always gently push backwards a bit, okay? And you will still stay in your neutral. The second most important is to have a gap here. The moment you lose the gap, you lose your neutral. You cannot engage your muscles properly without the neutral position. Okay? Not in the beginning, at least when we're learning to find our deep core muscles. So we lay down here, gap under our waist. You can support yourself with a hand as well. And we take a nice breath in into the side and the back of our lungs. Breathe out. Remember engaging our pelvic floor, zipping our core. Whilst lifting the leg up and slightly backwards, slightly, up to the point where you feel resistance. Feel that resistance. Feel the engagement and keep the gap. You will see that it might not be that easy if you're doing this for the first time. Okay, breathe in, engage, lift, resistance, find the resistance, keep the gap. And you immediately will feel your lower abs kicking in. Breathing in. It is very important to come up to the point of resistance, at least a little bit. If you just lift without reaching point of resistance, you will not be giving as effective challenge as it should be happening. Breathe in. My leg is itchy. Breathe out. Gap, 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 gap. Keep the gap. And engage. By now, I can feel my glutes burning as well, so this is good exercise for the glutes as well, but of course our primary focus is lower abs. Nice. So again, you can do 8 to 10 reps, and remember, of course, to do it on both sides. Alright, and that was it. That was your 4 exercises of 4 lower diastasis recti. If you have seen my upper diastasis recti exercises, and in case you have diastasis recti throughout your abdominals, guess what? You can combine these two. You can combine upper and lower abdominal exercises and you get workout for all of your deep abdominals. It is a great place to start. It is a great place to start defining your muscles, to concentrate on the area. Remember that diastasis recti does want some progressive challenge though, as soon as you can control the intra-abdominal pressure. But these exercises will definitely cover you in the beginning. I hope you enjoyed this video. Let me know what you think. Let me know if you tried any of these exercises. Maybe you tried one. Maybe you have questions. Maybe you struggle with them. I will be happy to answer any of your questions. Pop them in a comment. Don't forget to check out my new post-pregnancy recovery program online. You can do it from anywhere in the world. And we will see you back very, very soon. Bye.